Rudaina takes her daughter for medical checkups on a regular basis as part of a health routine for her children.
We have vaccinated the children since they were 2 months old, and they took the scheduled vaccines for 2.5 years from all types of diseases. There's more knowledge with television and social media about the importance of vaccines.
According to the UN, vaccines have saved the lives of more than 150 million people globally over the past half-century, about a third of them in Africa. In Egypt, vaccinations tend to center around BCG, polio, measles, and diphtheria tetanus.
In his mother's womb, the child is protected by her body and is isolated. Once out, the baby is exposed to thousands of bacteria in the environment and is so vulnerable. That is why vaccines are essential for immunity from diseases and bacteria that could be fatal for the baby.
That's why, for years and even decades, the government had embarked on several initiatives to vaccinate children. Established in 1897, the state-owned Vaxera company is one of the oldest in the region and is the main vaccine manufacturer in Egypt.
Egypt is one of the countries with strong vaccine systems because vaccinations are mandatory and parents who neglect vaccinations for their children are punished by law. We also launch continuous campaigns throughout the year for different ailments like polio, for example. We have nearly eradicated measles and polio in the country, again because it's mandatory and binding.
The UN has set global immunization targets for children by 2030. To achieve these goals, the Egypt's Ministry of Health is offering vaccinations to all children free of charge, in addition to launching awareness campaigns for parents to know about the importance of immunization. However, according to the UN, most of Africa, including the more stronger economies like Egypt, have not been able to reach the standard global average vaccine rate of 80 to 90% yet.
The challenges are in the rural areas and villages in Upper Egypt where access and awareness is not so prevalent. The state launches medical convoys countrywide who visit these villages for vaccinations. The government subsidizes the main critical vaccines, but for financial constraints, it is unable to provide free vaccinations for all diseases in this huge population.
Officials say further measures are being implemented to reach more children, especially in rural areas and suburbs.
After the baby is born, he is registered by the hospital and the parents are given a booklet with a timetable for every vaccination, and they have to go for the vaccine free of charge. If they miss a dose, the ministry calls the parents to remind them of the vaccines. This ensures more children will benefit from the service.
The government is adamant these measures will guarantee nearly all children will be immunized in Egypt by 2030. Yes, Hakim for CGTN, Cairo, Egypt.